Back here in Nigeria, the need for private sector support to government to aid the improvement of quality healthcare delivery through an effective health insurance system is being canvassed by experts. Well, stakeholders disclosed this during the Access to Finance Impact Program by the Delta State Contributory Health Commission and its private partners. The health experts say the private sector is in a better position to accelerate transparency, best practices and innovations to enable access to quality and affordable health care.
The contributory health insurance scheme in Delta State has really helped the Delta State government to provide primary health care to our citizenry. Before we came, it was a sorry state, and the governor, being a medical doctor, institutionalized this scheme, which is started in the Senate. And thank God we have a very good, knowledgeable people in this field like Dr. Nkechika and Dr. Povita, who pioneered it. Today, children under 5 and women going for deliveries have free health care.
Health financing is a very difficult situation in Nigeria right now, because the financial institutions really are not prioritizing healthcare financing, more so because they don't understand it. Which is why, as Farm Access Foundation and the Medical Credit Fund, we've taken an active role to educate and build capacity, not just of the SMEs, but also the financial institutions. The Delta model has shown that really a lot of effort can be put into building those partnerships, the public-private partnership, more so because the government is financially constrained in most instances, and they are not able to invest adequately to get all these primary healthcare centers working.
85% of the healthcare providers in the country are from the primary healthcare system, and which means that if you don't have 85% of providers open, viable and providing service, then there's a chance that 85% healthcare service delivery will be suboptimal, which is not ideal.
Well, for more on the Delta State access to finance and private sector support to governments to aid the quality healthcare delivery, we're now being joined by Dr. Ben Nkechika, the Director General of the Delta State Contributory Health Commission. Thank you so much for joining us on the news tonight. So from what we understand, this was an initiative that came on board in 2018. This is 2022. So that's enough time to say if it has worked, or if it hasn't worked, or if it is work in progress. What exactly has it been?
It has worked, and it's still work in progress, because it's not a program that has a destination. It's a program that is supposed to evolve across the country until we're able to achieve universal health coverage by the year 2030.
All right, it would be nice to have a picture of what it was before this, this A to F access to finance program. Apparently, the major issue here is finance. How have you been able to access finance in this 4 years that it's been on?
So in 2015, when the new administration came on board, we did a critical review of the healthcare system and the healthcare challenges across Delta State. And an interesting phenomenon came on board. We visited all the primary healthcare centers. And you find that in primary healthcare centers that were functional and open, the nurses have devised means of accessing finance to be able to run the facilities. In the areas where there was no population coverage and people are not coming there, they were a bit moribund. So first of all, we set up the health insurance scheme, which will basically capacitate the people to be able to afford healthcare services at little or no charge. And in that package, the vulnerable people who are unable to pay, the government pays for them. So first of all is the demand generation, getting people articulated and concise in a platform to be able to afford and access care. And next, we did an analysis of the healthcare facilities available to provide the care. And we realized that there were areas of the state in which healthcare services were just not there. And these are hard to reach areas, difficult terrains and rural communities. And we tried to find out what was happening. We realized that because of the terrain and the environment, the government workers were not willing to go there to work. The private hospitals were not willing to go set up there. But there's people living there and they're entitled to healthcare. So that was what led to this strategy. What will incentivize a private provider to go to those rural communities, set up and provide care? We advertised, some people, some facilities applied, and they will determine a framework in which we provide them the resources at very minimal or no cost, in partnership with Pharmacists Foundation and the Bank of Industry. So it's not a case of just throwing money at healthcare. Instead, it's a strategic approach to create that financial incentive, and private providers are now going there to provide care.
Because we know out of pocket for health is strenuous for anybody. Yes, but in terms of outcomes, can you give us in figures, in real terms, for the contributory healthcare system, what's the coverage like for Deltans, as they like to be called, and for the hard-to-reach communities, the private partnership you've had, how many of those healthcare facilities have been upgraded or facelifted or whatever you're doing to them?
Currently, the Delta State Contributory Health Commission has 1.2 million enrollees registered into the scheme. It's basically the highest in the country. And that's because we've been very strategic in getting that done. And the critical part of our strategy is to ensure that we carry the people that don't have access at all first into the healthcare system, and then we gradually bring in the people that have one form of healthcare service delivery or not. So that's why we concentrated on children under 5, pregnant women who are very vulnerable, and then according to our modalities, when we see people that are poor, unable to afford healthcare or health insurance, then we support them. But now these people don't even have the healthcare facilities to provide the care, even if we decide to support them. So that was why this strategy was put in place. And currently we have 15 facilities operating. We have 6 private providers providing care. And actually the phenomenon has come up with a new system where doctors are now going to the creeks to stay, work. And we devised a model in which we create the environment that they deserve. We make sure they provide them with catering, laundry and all that. So they stay there, work happily, take their time off, another doctor comes to cover up for them, and that has provided tremendous outcomes.
Right, you actually talk about the major success factor in this program, which is a political will. This looks like a template that you'd want to, use across the country. What are you doing in that direction to make this the norm in every part of the country apart from Delta State?
Yeah, so that was why the program today was well advertised, and we invited a lot of stakeholders, because first of all we had to ensure the framework was workable, that the framework would determine outcomes. So today's event was that the Dutch government, in partnership with pharmacists who provided some guarantees for it, now got an independent consultant to do an impact evaluation study of the program, and today was the dissemination of that report, and then getting stakeholders to come up with modalities and structures that can now scale it up across the country. So that's what it was. So
what are some of the deliverables going forward? What are some of the suggestions that actually came out of this event today that you're running with?
Yeah, the first thing is that there has to be the strong political will. Our governor, Senator Dr. Ifeanyi Okowa, was very purposeful, very practical, business-like, and gave us the full mandate to ensure that everybody in Delta States has access to quality healthcare service delivery, irrespective of the person's geographical location or socioeconomic status. So that's the first. The next is that there must be a proper framework, a proper analysis to determine what the people need, because most times healthcare is thrown at people without understanding what they need. The next is to have a mechanism in which the providers are encouraged and incentivized to provide care with guarantees that their service delivered will be compensated appropriately.
Dr. Nkechika, before we let you go, I mean, you've done this for 4 years. If you want to make it the template nationwide, what were the lessons you learned on the way? What were the stumbling blocks, the most difficult things you came across?
Well, the first and most significant is the fact that people had a lot of mistrust in government. So you find that even when you come up with such a program, they don't believe it. But we realize that the best way out of it is develop the champions, remain open, remain resilient. And you find that when people take a chance on it and they see it's coming out well, then they become the advocate across. So that ability to remain resilient, but ensure that you have a very proper, well-determined strategic framework that is implementable. That helps a lot. Fantastic,
because I was actually going to ask you how welcoming the communities have been, to this program. Dr. Ben Nkechika, DG, Delta State Contributory Health Commission. Thank you very much for joining us on Newsnight.